Hey, I'm Jack, and I'm one of Hi5's reputation managers. I'm here today to give you some tips for creating effective call to actions, or CTAs for short. A call to action is simply a direction given to an audience to generate a response. So whether you've realized it or not, you've come across CTAs before online. The Contact Us button at the end of an email, a schedule appointment prompt on a website, or a Call Now icon on a Facebook page are just a few examples of CTAs. The first thing you need to do is be specific. You need to be clear and concise with your CTAs. Use specific verbs and phrases when crafting your CTAs because vague CTAs will not convert. Here are a few examples of phrases that you might use for CTAs. Schedule an appointment. View specials. Watch the video. The next thing you want to do when you're creating CTAs is make sure to limit yourself. Options are normally a good thing, but in the case of CTAs, too many options can be a bad thing. If you overwhelm patients with a million choices, then oftentimes it can paralyze them and cause them to do nothing at all.
Here are two of our clients' websites. You'll notice they have very few CTAs on their homepage, which means they're driving people to do exactly what they want. They prove that in the case of CTAs, less is often more.
When you're working on your CTAs, you want to make sure to create a little urgency. Fear of missing out is a real thing, and if you can create a sense of urgency, people will act. Book now, reserve today, limited time offer. These are timely buzzwords and phrases that will cause people to act immediately. The next thing you want to do is position your CTAs appropriately. CTA placement is absolutely vital. You can have the most well-designed CTA in the world, but if it isn't positioned appropriately, it doesn't matter, it won't convert. And let's not neglect our mobile users. You don't want them to miss your CTAs because they're having to scroll around the page a lot. Lastly, make the follow-through process simple. Wouldn't it be awful to design an awesome CTA and have your patients click on that CTA just to watch them bail at the last possible second because the action itself was too complicated or too involved? The answer to that question is yes, that would be terrible. Make sure that your follow-through process is simple, that way all your work isn't done in vain. In conclusion, CTAs are everywhere, and your practice needs to be using them and taking advantage of them. Remember, be specific, limit yourself, create a little urgency, position your CTAs appropriately, and make the follow-through process simple.
We hope our tips were helpful, and if you have any questions about CTAs, please give us a call at 615-656-8551.